In this video, we will take a close and detailed look at how coffee affects the blood and blood vessels. You have probably heard many times that drinking coffee regularly can be harmful to the cardiovascular system and might even reduce a person's overall lifespan. But is that really true, or is it just a widespread myth? We're going to explore both the potential negative effects and the actual health benefits of coffee, so you can gain an objective and scientifically supported understanding. By the end of this video, you will have no doubt about whether you should continue drinking coffee and in what quantities. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Coffee-based beverages are well known for their energizing effect, which comes from the high content of a substance called caffeine. Caffeine is a psychoactive compound and a purine alkaloid that can stimulate brain activity and speed up metabolism. These days, caffeine is not only found in coffee, but also in most energy drinks, cola beverages such as Coca-Cola, and tea. This compound is also commonly used in migraine relief medications, as well as in stimulants for heart function and respiration. On average, about 20 minutes after consuming caffeine, a number of processes begin in the human body. For example, it blocks the receptors of a neurotransmitter called adenosine. The primary effect of adenosine is to slow down nerve signals and promote drowsiness. When its action is blocked, it leads to increased reaction speed, improved focus, and suppression of relaxation. Caffeine also stimulates the release of the hormone adrenaline, which raises heart rate, increases blood flow to the muscles, and triggers a release of glucose into the bloodstream. In addition, it boosts the level of the neurotransmitter dopamine, which is known for creating feelings of satisfaction, well-being, and emotional uplift. Spinal reflexes become more active, the central nervous system becomes more alert, and senses such as vision, smell, and hearing become sharper. Mental and physical endurance increases, along with overall productivity. However, about 2 hours later, the effects of caffeine begin to wear off significantly, which can lead to a return of drowsiness and sluggishness, unless caffeine is consumed again. Caffeine is naturally eliminated from the body within 4 to 5 hours. To understand whether regular caffeine consumption is beneficial or harmful, it is important to first examine how it affects the body overall. Let us begin by looking at what happens to the blood vessels when beverages containing caffeine enter the body. Scientific research has confirmed that caffeine has its strongest effect on the blood vessels in the brain. This is one of the key reasons behind its energizing impact. The energizing effect of the drink is not only due to its caffeine content, it also contains another alkaloid called theobromine, which actively influences the condition of the walls of the blood vessels. It is important to understand that different blood vessels react differently when coffee enters the body. Some of them expand, while others, on the contrary, constrict. The vessels that expand are the ones responsible for delivering nutrients to the cardiovascular and musculoskeletal systems. This widening of the blood vessels happens as a result of the relaxation of their walls, which allows blood to flow more freely. As a result, oxygen reaches certain organs more efficiently. This process helps explain the stimulating and energizing effect of coffee. In such moments, a person may quickly feel a surge of energy, an increase in productivity, and enhanced mental performance. This kind of effect is often sought by people who need a quick boost to power through tasks or responsibilities. It is especially common among creative professionals, athletes, students, and long-distance truck drivers. When coffee is consumed, the caffeine enters the bloodstream and begins to spread through all tissues and organs, triggering the release of adrenaline. This leads to increased tension in the walls of the blood vessels, narrowing of the arterial openings, and sudden changes in blood pressure. These shifts in pressure can have both positive and negative consequences. If coffee is consumed in moderate amounts, these changes are not harmful. In fact, temporary increases in blood pressure may actually help strengthen the durability and elasticity of the arteries. However, if the daily intake becomes too high, even completely healthy blood vessels may struggle to handle the extra stress. This is especially true for individuals with a history of atherosclerotic conditions, as cholesterol buildup can cause clots to break away from the walls of blood vessels. This creates serious risks, such as the development of heart-related or brain-related acute episodes. When blood flow increases to the organs of the excretory system, urination becomes noticeably more frequent. Along with urine, the body eliminates accumulated toxins and harmful substances. However, this process also flushes out calcium and other beneficial compounds. If coffee is consumed in an amount no greater than 2 cups per day, the loss of minerals is generally not significant. But when daily intake increases, the removal of these essential nutrients becomes more intense, which can have a harmful impact on overall health. For example, you might begin to notice reduced strength in bone tissue, weakened fingernails, erosion of tooth enamel, and hair becoming more brittle. Another unpleasant effect that may occur after drinking coffee is the appearance of discomfort or pain of varying intensity. This usually happens about 60 minutes after consumption and is linked to the widening of blood vessels in the brain, digestive organs, and pelvic area. When these blood vessels later narrow, the amount of nutrients and oxygen delivered to the organs drops. Because the intake of these elements decreases, this may also lead to a reduction in pain, including discomfort in the head area. Caffeine, as an alkaloid, is included in some over-the-counter pain relief medications, as it has a number of useful properties. These include a mild analgesic effect, stimulation of natural brain activity, reduction of passivity and drowsiness, improvement in concentration, enhancement of mental functioning, quicker decision-making, and increased physical endurance. Certain effects of alkaloids lead to an increase in blood flow to the heart, skeletal muscles, lungs, and kidneys. This influence triggers specific responses within these organs and their systems. Because caffeine widens the blood vessels in the heart muscle, the heart receives better circulation. In general, caffeine improves blood flow in areas where it may already be slightly restricted due to conditions like atherosclerosis. It also activates peripheral circulation. As a result, blood pressure may be stabilized by the mild action of natural hypotensive mechanisms, and kidney function is moderately stimulated. This stimulation improves blood flow to the kidneys, increases blood perfusion in lung tissue, promoting better oxygenation of the blood, and boosts circulation to the muscles. These effects help the body remove lactic acid more quickly after intense physical activity, speed up the recovery of damaged muscles, and enhance the lungs' ability to contract efficiently. Caffeine also narrows the blood vessels in the gastrointestinal tract, which contributes to the active production of digestive juices. In addition, it can help relieve discomfort associated with cystitis by narrowing blood vessels in the pelvic area. When it comes to the heart, perhaps the most widely known negative effect of caffeine is its ability to increase heart rate and raise blood pressure. This is directly tied to the primary action of alkaloids. Caffeine acts as a stimulant for the central nervous system and the brain. It helps accelerate certain physical responses, stimulates the heart, and widens some blood vessels. Of course, it is difficult to determine an exact amount of caffeine required to trigger an increase in heart rate and blood pressure, as it can vary from person to person. However, there is an average estimate. As little as 50 milligrams of caffeine may be enough to produce this effect. However, sensitivity to this alkaloid varies from person to person. This means the amount of caffeine that can lead to the development of tachycardia might be either more or less than 50 milligrams. In some cases, caffeine may not have any noticeable effect at all. At the same time, it turns out that drinking coffee may actually offer some protection for the heart. In a group of individuals who consumed 2 to 3 cups of coffee per day, the risk of heart-related problems was significantly lower compared to those who drank either more or less. Even just 1 cup per day may be enough to reduce the risk of stroke or serious cardiovascular events. According to a study by the American Heart Association published in the year 2023, moderate coffee consumption, defined as 1 to 3 cups per day, was linked to a 15% lower risk of heart failure compared to those who did not drink coffee at all. One of the most common concerns about coffee's impact on the cardiovascular system is its ability to raise blood pressure. However, this effect is usually very short-lived. Most people with high blood pressure can safely consume caffeine in moderate amounts as long as their symptoms do not worsen. Research also shows that people who drink coffee regularly over long periods may actually have a lower risk of developing hypertension. This is partly due to a unique compound found in coffee called chlorogenic acid, which has antioxidant properties. These antioxidants help keep heart muscle cells youthful and healthy. A study conducted by the American Institute for Nutrition in the year 2022 found that regular coffee drinkers had a 20% lower risk of developing coronary heart disease compared to those who did not drink coffee. Caffeine also has a positive effect on the tissue lining the inside of blood vessels and the heart. When this tissue functions properly, it allows for smooth blood flow, which in turn helps maintain a healthy rhythm of the heart muscle. Chlorogenic acid plays an active role in the blood clotting process and helps platelets adhere to the walls of blood vessels when necessary. To get the most benefit from drinking coffee-based beverages, it is important to understand which type of coffee is the most beneficial. Numerous studies have shown that filtered coffee is the best option. This type of coffee is made by passing hot water through ground coffee placed in a filter. As the water seeps through the grounds, the coffee develops a rich flavor while retaining all of its beneficial compounds. The used coffee grounds are discarded afterward. Filtered coffee is widely considered the healthiest choice among all preparation methods because it preserves the maximum amount of the coffee bean's beneficial properties while removing harmful residue. This type of coffee has been shown to reduce the risk of cardiovascular complications and contains a high level of antioxidants, which help keep cells youthful and healthy. The least beneficial type is unfiltered coffee, meaning coffee that still contains coffee grounds. This kind of drink is typically brewed directly in the cup. Coffee made in a sève or with a French press is also less beneficial than filtered coffee. This is because unfiltered coffee contains approximately 30 times more cholesterol-raising compounds than filtered coffee. As a result, it places greater strain on the heart and may contribute to the development of atherosclerotic plaques and blood clots. It is important to understand the advantages of ground coffee over instant coffee. Of course, it is much easier and faster to prepare a cup of coffee using instant powder. However, this type of drink is significantly less beneficial due to the addition of various preservatives. Also, during the process of turning coffee beans into instant powder, most of the essential oils and useful nutrients are lost. To make the powder dissolve in water, it goes through multiple stages of processing, which removes almost all remaining vitamins. In addition, instant coffee often contains added stabilizers, artificial flavors, coloring agents, powdered cream, and sugar, none of which contribute to the health benefits of the drink. It also contains much less caffeine than ground coffee. According to the United States National Coffee Institute's report from the year 2024, instant coffee contains between 40 and 60% fewer antioxidants compared to properly prepared ground coffee. Still, even high-quality, properly prepared coffee beverages have certain limitations. They are not recommended for people with high blood pressure, poor circulation in the brain, severe heart conditions, head injuries, increased intraocular pressure, varicose veins, aneurysms, thrombophlebitis, or atherosclerosis. In such cases, avoiding coffee altogether may help reduce the risk of complications. It is also not advised to consume coffee within 14 days after any surgical procedure, especially if it involves the heart or brain. People over the age of 60 should also be cautious, as coffee can place additional stress on the heart muscle. If you are experiencing stress, intense emotional tension, or have had a sleepless night, coffee might lead to negative effects such as general discomfort, fatigue, nausea, dizziness, and headaches. It is also best not to drink coffee immediately before or after physical exercise. Even people in good health should carefully monitor how much coffee they drink and avoid exceeding the recommended amount. What do you think about this? Do you agree with these points? If you have any questions, feel free to ask them in the comments. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.